Hello, everyone. Welcome. We're so happy to be here live with you today. Welcome, and thank you for joining us for our special educational symposium sponsored by Aurinia Pharmaceuticals. My name is Kelly, and I am the creator and executive director of the Portland-based nonprofit More Than Lupus. And if you are unfamiliar with More Than Lupus, we are a multi-ethnic, multi-generational, and international lupus community designed by lupus patients to connect, to grow, and to hopefully inspire each other throughout the peaks and valleys of our lupus journeys. And I say "our" because I am a pediatric lupus patient and have lived with systemic lupus and multiple lupus overlap conditions since the age of 11. Now, we believe that every person living with lupus, no matter their background, should be treated with equity and dignity and taken seriously. And it's our mission that patients feel heard and seen and valued. It is also our plan of action to continue to spotlight minority populations disproportionately affected by lupus and lupus nephritis. And today's event will spotlight the unique challenges of people living with lupus nephritis. And we hope the information provided today can be used as a resource that hopefully propels you to have an open and honest conversation with your doctor or doctors about ways that you can be more engaged with your kidney health and be vigilant if ever lupus nephritis bubbles to the surface. By the way, please make sure you share this live event on your Facebook page so that other people can get connected to community of support and resources and have access to the incredible information that will be shared today. So before we go any further, let me give you a brief disclaimer. Please understand that the opinions shared today are purely for informational purposes and do not replace the medical advice and/or opinions of your doctor or doctors. If you're experiencing lupus or lupus nephritis or lupus overlap symptoms, it's important to follow up with your doctor and to seek the treatment that is best for you. Our panelists are qualified medical professionals and advocates. However, they are not liable for their comments since they are not acting as your personal physicians or health advocates. It is time that we as a patient community delve deeper into this topic and conversation, and I am thrilled to have with us Danny, the Strategic Alliance Manager and Advocacy Representative for Aurinia Pharmaceuticals, here to introduce our first speaker. Thank you, Danny.
Well, thank you, Kelly, and good afternoon, everyone. My name is Danny Martinez, the Strategic Alliance Manager with Aurinia, and I'd like to thank Kelly and the More Than Lupus for the opportunity to partner with our group and bring this important talk about get uncomfortable prioritizing lupus and your kidneys. As you may be aware, Aurinia makes a medicine for adults with lupus nephritis. However, today's presentation will not discuss any medicine and will focus on the importance of early detection through routine testing and the management of lupus nephritis. We look forward to sharing information about our medicine at a future program. At this time, it is my pleasure to introduce your speaker for today's program, Dr. Laura Geraldino. Dr. Geraldino is an assistant professor and the director of Lupus Clinic at Columbia University. She graduated from Intec University in the Dominican Republic, and she completed her internal medicine residency in SUNY Upstate and a rheumatology fellowship at Columbia University, where she stayed on as a faculty member. Her areas of clinical and research interest include systemic lupus erythematosus, rheumatoid arthritis, and musculoskeletal ultrasonography. She has been the director of the Lupus Clinic at Columbia University since 2010 and has been awarded a Rheumatology Scientist Development Award from the Rheumatology Research Foundation. And with that, it is my pleasure to introduce Dr. Geraldino.
Good afternoon, everyone. It is really a pleasure to be here with you, talking about a topic that's really dear to my heart, one of the most important complications that we can see with lupus. So, with that, we'll get started on this important topic. So, we can go to the next slide. And next slide. And what better way to get the talk going than with using the wise words of an actual lupus warrior that says, when it comes to lupus nephritis, what you don't know can hurt you. I'm hopeful that stepping into the uncomfortable spaces of lupus nephritis will be both empowering and life-changing. And I couldn't have said that any better. So that's great that you're here with us tonight. And the more you understand about how this condition presents, what we can do about it, how we can check on it. Of course, the more empowered and life changing this can be because we can treat it promptly. And that's really key and essential. So next slide. And I'll just start with a brief, discussion about what is lupus. So we know that in this condition, what happens is that our immune system that normally, will protect us from harmful things. So, for example, infections, cancers, cancerous cells that are growing in the body, our immune system will fight those things. That's what it normally does. But what happens in lupus is that that same immune system gets confused and starts attacking our own organs. So it's not that we caught some infection, it's not something we acquire from somebody else who was sick, it's actually our own immune system that starts attacking different organs in our body. And that causes inflammation in the different organs that are being involved at any given time, which most often what we see is that rashes tend to be common, especially like around the face. And we call that the butterfly rash. That's very common. Also, the joints swelling up, in particularly arthritis in the hands. Those are things that are very visible. But depending from patient to patient, the symptoms vary quite a bit. Some people only have those symptoms I just mentioned, but other people can have internal organs being involved, meaning things like their heart, their lungs, or their kidneys. So when the lupus affects the kidneys, that's what we call lupus nephritis or LN. You will commonly hear people referring to it that way. But that's what it means, that inflammation, that attack of the immune system on our organs is happening to the kidneys. So, and something that is key is that it's not as noticeable as, for example, when we have a rash, when we have swollen joints, that we can see right away. So it's easy to know that that's happening and that the lupus is active in those particular organs. But it's not the same when it is the kidneys that are being affected. It's not as visible. It's not as clear what's going on. Next slide. So, what are the kidneys doing? These are one of our essential organs in the body. So, the kidneys are the ones in charge of a very important task in the body. They have to filter our blood to get rid of waste and toxins and excessive water. So, they are great at regulating that fluid water balance in our body. So, what happens with lupus nephritis is that as there starts to be inflammation in the kidneys, then they stop working properly. They can no longer get rid of all the waste. They can no longer balance that content of water that we have in the body. So we start retaining fluids. The kidneys stop functioning as they properly would do because of that inflammation. And the thing is that the longer that inflammation in the kidneys goes on for, then we start getting into damage, which is very different. It means like already the kidneys have some irreversible problem. Like part of that kidney is already destroyed and cannot come back, which is why we always want to try to pick up any problems with the kidneys very fast. And while it is still inflamed, something we can treat with medications. And now that it's moved on to becoming scar tissue that has already undergone damage that we cannot change with things like medications. So that's what happens when the kidneys get affected. Next slide. And as I was mentioning before, the symptoms, how you can recognize if lupus nephritis is happening, might not be very obvious. So we have to be pretty savvy and know, like, what are those subtle things that could be going on that could indicate that there's any problems with the kidneys, because you might not see anything abnormal. However, it is common to have lupus nephritis. I mean, it's something that affects 1 out of 2 people with lupus. So it's not rare. We're talking about half of the people living with lupus gets this particular organ involved. They get lupus nephritis. So it's very important we know all the tools and that we're checking routinely so that we can tell right away if this is happening. So that inflammation in the kidneys, as I was mentioning, can lead to damage the longer it goes on for. And what happens once the kidneys are completely, they're completely done, they've turned into scar tissue, that's not something that will ever work. And at that point, then we find ourselves needing some alternative for that function that the kidneys were serving, with clearing up the waste and toxins in the body and balancing our water content. So then we need things like dialysis or a kidney transplant. So obviously we want to prevent the kidneys from getting to that stage. But those are the ultimate consequences of when those kidneys continue to have inflammation for a long time and then become damaged. And if we think about it, it's not actually even just the kidneys. The kidneys do have this very important task, right? But in addition to that, it's actually that when the kidneys fail, then that puts a big burden on the rest of your body. As if it was not enough of that big task the kidneys are, in charge of. But also when we're then retaining fluids because the kidneys are not properly getting rid of it, then what happens is that puts a burden for our heart. Our heart is more, it's stressed because it has to deal with larger volumes of fluid that it's not normally meant to. So then that heart becomes burden, and then you end up having also then now heart disease because as a consequence of the problems that started with the kidneys. And with that, then you have high blood pressure. That's what causes that problems with the heart. And then we have higher risk for things like heart attacks or strokes even. So because of this, it becomes like a domino effect. So we want to really, diagnose this early, make sure it doesn't progress that way so that we don't have those types of complication. So we can stress anymore about how early diagnosis and treatment, it's really essential. That's what we are here for, talking about that so that, we can intervene when things are earlier on and we know we can change things. Next slide. And I said, that it's not very obvious. It's not like the male or the butterfly rash. It's not like the arthritis that's very obvious. But, it's important we know some important facts about when the kidneys are involved in lupus. So we said it's about half of the people living with lupus will have this happen. And of those that do get the lupus nephritis, that get the lupus in the kidneys, we have that 1 out of 3 actually progresses, like it evolves into that kidney failure that we want to avoid. So with that, when the kidneys fail, we really are not talking about just a big burden in other organs of the body, but actually really that impacts our survival. So then we live less years, less amount of years. The risk of death is greater when those organs are not working properly, when the kidneys don't work properly, and then that gives you all those other complications we just went through, like heart attacks and strokes. So it's important to know that so that we can be screening for it, checking for it, regularly, so that we don't reach those endpoints. And one thing to keep in mind too is that depending on our racial, ethnic background, well, there are differences. We know that lupus nephritis is more common, and lupus in general is more common in people that are Black or of Asian descent. So we know that about 4 times more likely for this to happen in this kind of populations. And still we see then also 2 times more likelihood of this happening in Hispanics and Native Americans. And this is all comparing to white people. So even more so, if we know we are in one of these racial ethnic backgrounds, then we want to even be more vigilant. But regardless of the background, we want to be checking because we don't want to be missing something that we could have easily detected if we did some testing. But the good thing, I know this all sounds very grim, is that we do have things to do to make sure this doesn't happen, to diagnose it early, to intervene early so that we don't run into all of these complications and negative outcomes. Next slide. And, managing lupus nephritis is, of course, very important. And early diagnosis leading to prompt treatment is essential. And all of this really relies on testing. Because, like I said, maybe there are some symptoms you can tell when the kidneys are not working properly, like fluid retention, we're retaining a lot of water, maybe gaining weight faster, maybe the legs are swelling up. But really the most reliable thing is testing. And this is another wise message saying about another lupus warrior saying it's time to get real. Lupus nephritis patients may have odds against them, but we do have the power of choice. We can do our part. So actually checking on simple things like blood and urine comes a long way. Next slide. And what are we really talking about? So it's not a difficult diagnosis. So that's the good thing. Like your doctors can detect if there's any suspicion for lupus nephritis with 2 easy tests. So it's just getting some urine and getting some blood. So, it can be hard, like this slide says, monitoring signs of lupus nephritis, but without the test, it's way harder because of what I mentioned. It's very subtle, even when you have some symptoms. We actually might not notice anything. And then we find the surprise that the kidneys are leaking a lot of protein. The kidneys are not filtering that fluid properly. So that's why these tests are so important. And again, they're pretty easy tests, nothing fancy. We're talking about just getting a sample of blood, getting a sample of urine. So in the urine, that's the most informative, one of the most informative tests that we'll get for this. So what we are checking in that urine is the levels of protein. So that's called when the kidneys are just leaking, letting the protein fall through that urine. That's called proteinuria. It just means that you're wasting the protein in the urine. Normally, we would retain most of that protein. We're not really wasting protein and letting it go in the urine. So when that's happening, that's because the kidneys are not working properly. So your doctors with that urine test are measuring exactly how much protein is leaking through the urine. And then they can know, if it's too high, well, this is clearly abnormal. Something is happening with those kidneys. They're not working properly. The other thing we can detect in that urine is blood. So also when the kidneys are not working properly, we can see blood in the urine. And it might not be visible. It might not be like a macroscopic thing. Your urine might still look yellow, but when it's taken to the lab and they count and see everything there, they do see then the blood cells there. So that's another important thing. And that's called hematuria. Heme just for blood or red blood cells. So that just means that we're losing blood in the urine. And that's another sign that things are not going very well with that. And for the protein that I mentioned before, the magic number or the main number that your doctors are looking at is if the content of the protein that's in that urine, if it's greater than 0.5 grams. So it's just a good number to have to keep in mind, just to have an idea of like, what are we really talking about? Especially because since I mentioned your doctors are regularly checking for this, you could, and now we have electronic medical systems that we can actually check how all of our labs are doing in the portal. So you could just take a peek. Was my protein level in the urine less than 0.5 grams? Or maybe it's not, but maybe it's improving. So it can give you a sense of what's happening. So that's a really important number to keep in mind. And I also mentioned the other part of the evaluation is the blood. So we'll do tests in the blood that also give us a sense of how the kidneys are working. And there are 2 main things we're looking there. One is called the serum creatinine. And like I mentioned, the kidneys are getting rid of waste products from the blood. So that's what the creatinine is the waste. As the kidneys stop getting rid of the waste, then those levels can go up. And the other thing is called what you see there in the slide EGFR, and that just means estimated glomerular filtration rate. That means how good are your kidneys are filtering. Are they filtering the fluid properly or not? So if that number goes low, it means they're not being able to filter as they should. And then you'll get that abnormal number also in the blood. So that's another key to be, to indicate that there could be issues with the kidneys. And that gives us an idea, the blood and the urine. The way we actually confirm what's exactly happening in the kidneys is with a kidney biopsy. And it's really important to do so because there are different levels or different ways in which the lupus can affect the kidney. So you want to know exactly which of the ways is happening. And also the kidney biopsy gives us very important information about which medications you're more likely to respond to, because depending on exactly what's going on with that biopsy, how much inflammation, how much is already scarred tissue, what other things could be going on around there, that makes your doctor have a better idea of what would be the best treatment for you. So that's how we ultimately confirm that. And because, like we said, 1 out of 2 people living with lupus will get this lupus nephritis, this involvement of the kidneys. So we want to really be checking everybody with lupus and at least once every 3 months. We don't want to take chances with this. We already said it's very common. It can have a lot of complications. We want to pick this up early so we can treat it promptly. Next slide. And so I kind of mentioned a little bit about this, but there are sometimes some symptoms that we can identify. They may go unnoticed, yes, because they could be quite subtle in it, but it's important to know which symptoms could be related to kidney involvement. And it's important to know them so that we don't ignore them. We don't want to ignore those. We want to immediately, even if we've already had a test within those 3 months, if something has drastically changed, we want to reach out to the doctor and not wait for that follow-up appointment that maybe is 3 months away. We're going to say, something is different now. I think, can I come in? Can I be evaluated? Because you're not feeling well. Some of the symptoms, while they can be subtle, but some of the things that can be associated with kidney issues or abnormalities is, for example, because we said the kidneys are balancing the fluid. So we start getting swelling, visible swelling. The legs are getting big. And it starts, with gravity. So it starts from the bottom and going up. So first thing will be, you'll see the feet swelling up, and the worse that fluid retention is, then we can start seeing the legs becoming swollen. And then sometimes it comes all the way up to the legs. But that could be a sign that, obviously the kidneys are not managing the fluid content, the fluid balance in the body properly. The other thing is, you've, for example, always had normal blood pressure. Suddenly you go to an appointment or something and somebody tells you your blood pressure is so high. Oh, what's happening? So this new, unclear, unexplained, sudden high blood pressure, well, it could also be that. It could be that the kidneys are not working properly. And because all that fluid is building up and being retained, now those arteries, those blood vessels, they're getting very stressed and having to deal with that volume, and then your blood pressure goes up. So that's another thing. And in terms of how the urine looks, the most common appearance for the urine is looking very frothy or bubbly. It's kind of like when you pour detergent into the toilet bowl, you see all these bubbles forming. So that's the most common appearance of lupus affecting the kidneys, of lupus nephritis. And what those bubbles represent, that's actually like that you're leaking protein. That's how that looks in that urine. A lot of bubbles, that might mean you're leaking protein. So that's another sign. You start noticing that all of a sudden, you let your doctor know, well, let's look at this because this is clearly a change and this is not the normal appearance of my urine. So that's something very important. And again, it's very essential to have that communication with your physician so that, yes, you have scheduled appointments, but if at any point any of the symptoms arise, you don't wait for that. You just reach out. Something's not right. I'm noticing this, that, or the other. Next slide. And it's sometimes good to just have some good tips on how to prepare for these visits because, I mean, we know these appointments are not every week. I mean, they're sometimes spaced out, and you want to make the best out of those encounters and that time with your physician. Although, like I said, if at any point you feel something's not right, you just reach out immediately and just go for it. But some good tips to bring for your appointment. I think it's hard to remember everything that has happened between appointment to appointment. So it just makes it easier to write things down, because you might just forget when you go, if especially if it happened like it was a few weeks ago. Maybe it's not so active right now, but it might be something important. So I think it's good to just write things down. Of course, if anything's urgent, you let them know right away. But if it's not, you might just write it down and make sure you bring it up at the next encounter with the doctor. It's also good to just, have a sense of your labs. And that's why I was going with an important number to remember is that zero point 0.5 grams in the urine, because then you have some very good sense of what's happening with your kidneys. Something you can look up in the portal and you can see exactly what was your protein in the urine. It will say that urine protein, and then you can just see if it was below that number, the 0.5, was it higher? And if you've already been diagnosed with lupus nephritis, then in your own treatment, then you want to see how that's going down and becoming more normal. So that gives you a good sense of how things are going. So it's good to, have an idea about those, and the blood work too. Like I said, in the blood, we're measuring how good your kidneys are filtering. So you could always look at it and before your appointment and discuss those with your physician. I think if we want to go back to that slide, I just wanted to mention a few other things that are good tips, because it could end up being a lot of providers, a lot of appointments. Because, for example, when the kidneys are being involved in lupus, you're not just seeing your rheumatologist, but you're actually also seeing a kidney doctor. That's the person that will perform the kidney biopsy. You might be seeing if there's some heart issue, you might be seeing a cardiologist. You're also seeing your primary care. Maybe you're doing physical therapy. It can be a lot of things going on. So it's just nice to write all those things down. Nobody can keep track of so many things, especially different locations and things like that. The other thing is, I think it's great to just bring somebody, some close person in your life, a friend, a family member, because, you might forget things, or you might receive a lot of information at your visit. It might be that, there's a flare in one organ and you started on different medications, and the plan can include a lot of things to do. Go see this person here, biopsy here, come back for a checkup, come back for labs. It could feel like a lot. It's a lot. And we're busy. We have our lives. We're doing a lot of things already. So it's easier to have somebody come with you. They can help you. Another set of ears to listen to everything that's going on can come a long way. And again, because the medications can become lengthy, we sometimes need to use different medications to try to improve things very fast. And it could be a long list there. How could you remember so many things? And you want to make sure nothing is interacting, especially if you have other medical problems besides your lupus. So it's just good to bring all your meds. Bring all your meds to your appointment, or a list, of all the meds, so that your doctor can be sure of everything that you're on and make sure it's safe also. And the other thing is, you're your best health advocate. So that's clear. You're all here today, and it's a Friday. So we really appreciate you being here, learning more about your lupus. And that's a huge step. You're giving up your Friday afternoon to be learning about this. And this empowers you, and this makes you, more knowledgeable and know what things to look for, so that your kidneys are doing okay. Next slide. And so I've been reading a lot of wise words, right, from different lupus warriors, and I wanted to also read this one to you from the wise Toni Braxton. As you know, so she's another lupus warrior, and if we always find it so hard as regular people to, be able to deal with all this appointments, all this testing. Imagine somebody, a celebrity, with all the things that they have to do, the crazy schedules they have to manage. But despite all of that, this is what Toni says. I see my doctor at least every 3 months for urine and blood tests to make sure the level of protein in my kidneys is being closely monitored. So if even Tony can find the time, I think we should all find the time to make sure, our health is doing okay, make sure we're not, lagging behind, because we don't want these problems to be identified late at a point in which, oh, well, there's not so much that can be done because there's already all this damage. So keep that in mind. She can do it. You can do it. So it's great to be here with you. I'll answer a few questions after this. I think that's our last slide, but I wanted to leave you put the next slide on because this is a whole campaign called Get Uncomfortable, and the whole message is that we know that managing lupus nephritis is hard, but of course, it's worth it. And we went through why it's worth it. We want to make sure you get treated, that you don't run into all those complications we went through. So take a look at this campaign, and I hope that you are, lined up, scheduled to do your testing at least every 3 months. Remember, and I'll take some questions now.
Thank you so much, Dr. Geraldino. What a informative and jam-packed presentation. I'm going to leave up this slide for a little bit so people can scan the QR code on the screen, which will take you to some great resources and information. We have a lot of people joining today all over. We've got East Coast, we've got Chicago, we've got West Coast, and we even have the UK. We've got someone in the UK too right now. We have some people commenting in the chat box, but I would love to go to some of the pre-submitted questions first, and then I think we're in a good place for time to go back to get to these other comments and questions here. So, Dr. Geraldino, patient compliance can be tricky. In fact, statistics say that 50% of patients do not take their medications as prescribed by their physicians. In your opinion, with lupus nephritis, why do you think that is? And what can we do to improve patient compliance, in your opinion?
Yes, and actually, some of the numbers you're quoting there, that tends to be the case for any chronic disease, meaning high blood pressure, cholesterol, anything that implies taking medication for the long run. So it's unfortunately human nature to think either, I've taken this for too long already, or I'm feeling okay. Perhaps I don't need it, even though that's what made it better. But it's just, it's tempting to have those kinds of thoughts. Especially, I think in lupus, we know it's the compliance, the adherence to those medications is even worse because it's young people we're talking about. So the younger you are, the more immortal also you think you are. And you kind of think things are going to go away. And, I have to include myself in that group. I, had some issue with the eyes. I was given some drops. I was told to do that for 10 days. I felt very good after 2 days. I'm like, maybe, maybe I don't need the 10 days. But it's human nature to do that. And I think the younger you are, the busier you are with life. And it is tempting to not adhere to those medications. The other thing is, they come with side effects often. So, okay, maybe it's helping me a lot with the kidneys. It's great. I'm hearing my doctor saying the protein levels are lower, but I don't feel great taking 8 pills. So we try to decrease as much as we can the burden of so many pills, because even if it's improving, sometimes you don't feel so great. But we just have to know that most of the treatment, and I think this is how we can improve the adherence, the compliance to the medications. Most of all this aggressive treatment is done shortly. Maybe you'll stay on a couple of medications for a long run or longer periods of time. But when something is really active, like the kidneys are being involved, we do want to take everything. We want to help those kidneys right away, make sure they can normalize as fast as we can, because that's actually going to be the best way to get off all of these meds faster. So I think that just presenting it that way, make sure people understand why is it so important to do all of these pills. Can I just do a couple of them? Are they all important? I think if you understand what this one is for and the other one and the other, then you'll see the value in them. It takes time, and sometimes I know maybe the providers don't have the time to go through all of them, but I think it's important. So just so that everybody knows why we should do all of these things.
Yes. So information,
Mm,
increasing health literacy, which is exactly what we're trying to do with presentations like this, so that patients can feel empowered in their doctor's offices to ask the important questions and hopefully dispel the fears and have that shared decision making. Because I know a lot of times it's fear that stops most patients from taking medication. And maybe they don't have a relationship with their doctor where they feel they can ask. Or culturally, there are some barriers as well with language and different things. So, as much as we can do to get information into the patient's hands to help the fear go down, to know this medication is prescribed because the doctor feels that the benefits outweigh potential side effects. Thank you for that. That's so important. Now, you mentioned with getting diagnosed that there's the urine, there's the blood, but the definitive way is with the kidney biopsy. And Dr. Geraldino, I can't tell you how many times patients reach out to me and say, I've just been asked to do this and I am so scared. There's
mm.
something about the kidney biopsy that really has a lot of fear attached to it. I'm just wondering, we know that it is a pretty straightforward procedure. It's done many, 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 many times a day throughout the US. The risks are low, but it is such an essential test that a lot of patients put off and have so much fear around it. Could you just kind of, in a nutshell, tell those that are watching and streaming this later what is entailed in a kidney biopsy so they can understand?
Yeah, I think, and thanks so much for raising this point because that happens often. And you think that this biopsy is happening, especially because we need our nephrology colleagues, and then you're like, what happened? Oh, well, she didn't want to do it, or he didn't want. So, and I think the fact that it's a biopsy, and you're like, oh, well, this is a procedure. Oh my God. So that it seems, I mean, it is a biopsy and it is a procedure, but it's actually an elective procedure, meaning you're not admitted to a hospital. You just have to go in to a suite where they will give you anesthesia. So it's nothing painful either. I think there's also like the idea that maybe this is going to be something painful. So it's not painful at all. And it's a brief procedure, elective procedure that for which you don't have to be admitted, and literally what they do is they look with imaging like a baby ultrasound equivalents, and they will just go with a needle and take a little bit of that. And that's really all there is. So it's yeah, it's a procedure, and there's the very, very unlikely case that maybe there's a little bit of a bleed or there could be a complication from the procedure, but for the most part, it rarely, I still haven't seen any complication from that. So it's a very, very safe procedure. It's elective. It's done under anesthesia, so you're not suffering, and it tells your doctor a lot of information. But I see the reluctance. It's also, if you, especially if you've never had a procedure, that sounds like it could be very invasive or lead to a lot of complications, but it's really well tolerated, very well tolerated.
Mhm. Thank you for answering that. I think patients need to hear that many times when they're told to
Mhm.
go and get a biopsy for diagnostic purposes. So we talked about the diagnosing, we talked about different treatments. Is there, though, a lupus nephritis diet? I mean, that's another question we get asked a lot, and there's some of those questions popping up in the chat box.
So there isn't a specific lupus nephritis diet, but because we know that what happens when the kidneys are not working properly is that we build up fluid and we have high blood pressure. Because we know of that, then we want to try to avoid those things from happening. So some of the key things in terms of what to eat with the diet is to try to have a low salt diet, We don't want processed foods because they're very high on that. So our main goals here are kind of to follow a healthy heart disease or cardiovascular diet in which we don't want to have high blood pressure, we don't want to retain fluid. So that would mean really that the healthiest diet tends to be like the Mediterranean like diet, so favoring things like white meats and fish for your protein, and then making your plate have like 2/3 of it be vegetables. And then you want your healthy fats. Some of the healthy fats are things like avocado has a lot of healthy fats, or nuts, for example, olives. So that kind of diet, that's the most healthy, and especially because we know of all the potential complications that stream from that involvement of the kidneys.
Mhm. I love the Mediterranean diet because you can also have dark chocolate on the Mediterranean diet.
Very
Little tip.
important.
Yes. And another thing that I love that you mentioned about the edema, the swelling, which is, as you mentioned, probably the first sign, if not the foamy urine for lupus nephritis being active. Um, People say, well, why would my feet swelling or my ankle swelling have to do with my kidneys? And you mentioned a great thing, gravity.
Mm,
Gravity, everything gets pulled down, guys. So that's
yep.
why that happens. Never think about that. But yes, good old gravity is what's causing your ankles to swell from the
It's not
kidneys.
only causing wrinkles, it's causing that.
Thank you, gravity. Wonderful. So, Dr. Geraldino, what would be a question that you wish your patients would ask you to be more proactive with their own kidney health?
I think, in general, especially knowing like how the compliance and adherence to that medication could be quite challenging, I wish that if the patients knew they were not going to take a medication, because sometimes I think they just feel bad to tell me, look, you're sending me that and I'm not taking it. They feel bad about telling me that. And we actually have counselors in our clinic, and sometimes the counselors tell me, she told me she didn't know how to tell you that she's not taking that. So,
Oh,
and I'm like, but I'm so glad to hear that, because otherwise I would think is that medication failed, that I had to like do something completely different. So I really wish, I think that's my number one wish, that if there's any concerns or issues with taking a medication, instead of stopping and not letting me know, to just ask me and tell me, I want to stop this because of this, that, or whatever is going on, so that I can see, oh, maybe we can get rid of that side effect if we lower it, or if we, so that we can play around with it rather than stopping it and we don't know what's happening. So I wish those questions came more often, but I see how it's like a bit uncomfortable to be telling your doctor, I just haven't been taking that for 2 months. But I think it's good to have that honesty, and it's good to have those questions of like, I don't feel well on this. Do you think I can stop it? Because maybe, yeah, we should stop it and change to something else rather than not be treated.
mhm. So honesty is the best policy.
Mhm.
Okay, here's a great question from Donna, who is in Michigan. She says, when kidneys are acting up, can you feel pain? One nephrologist said yes, and another one said no. Yet I have heard many warriors complain that their kidneys are hurting.
So, technically, if the kidneys are having problems from the lupus only, then you shouldn't be having any pain. So, common pain with the kidneys comes more so when there's like a kidney stone, which could be quite painful. But because the kidneys are not filtering properly or the kidneys are leaking protein, those things don't tend to cause pain. There could be other things going on that could cause pain. But strictly from the lupus nephritis, you shouldn't expect any pain in the kidneys from that.
Interesting. Interesting. What about an infection?
So infection can absolutely do that. Infection and kidney stones can do
Mhm.
that. Or it
Mhm.
could also be sometimes we see lupus with a cousin disease, I call it, but a clotting problem sometimes comes along with the lupus called antiphospholipid syndrome. And if there is a clot and then it's more of an infarct that you're having, it's like the kidney's not getting blood flow because of the clot, that's a different scenario. But
Mhm.
technically, if it's just the lupus nephritis, the lupus inflammation in the kidneys, that should not give you any pain.
That's interesting you say that. We have Kira joining from the UK, and she had many years of being misdiagnosed from her comment, and she has lupus and antiphospholipid syndrome
Mm.
and autoimmune vasculitis. She's failed some medications, and she's starting rituximab in 3 weeks, and she's scared because she's been allergic to some other medications in the past, and she's just looking for some positive feedback. And is there a more higher rate of incidence with people who have antiphospholipid developing lupus nephritis earlier or maybe more severe?
Yeah, so it's actually a completely different problem. With the lupus nephritis is inflammation in the kidneys. With something like antiphospholipid antibody syndrome, it's that there's a blood clot, and then that's what's not allowing the kidneys to get normal blood flow so that they can function normally. It's two different things. But we know that we can have both things actually happen. But it's not that because you have antiphospholipid antibody syndrome, you'll be more likely to have inflammation in the kidneys. So it's something to keep in mind. The other thing is that if that syndrome is happening, if somebody has already been diagnosed with that, you'll be on blood thinners for to use and take for life, so lifelong. So that will prevent clots from forming. You just have to make sure it's being treated because obviously then blood clots could form and go anywhere, and that
Mhm.
can be very risky. Um, you know, I know we're not talking about medications here, but one thing that's good, I would say, for our friend in the UK is that infusions like that are usually done in the hospital. So you will be monitored and supervised, and overall, they tend to be very well tolerated. And we still do that for the very unlikely chance that there could be something more like an allergic reaction if this is the first time you're getting a medication through the vein. So it's more to like monitor for that. But overall, these are medications that have been around for a long time now, so decades. So it's
Mhm.
something that there's a lot of experience with, and that it's done in a hospital setting, and you're monitored, very well monitored. So it could.
Mhm. Yes, yes. Okay, here's another question regarding supplements with lupus nephritis. Um, is magnesium or something like magnesium harder on the kidneys if you have lupus nephritis?
So the thing with the supplements is that you just have to be careful, where you're getting them and what kind of ingredients are really in it. That's what it comes down to. So I think they're mainly advertised as like it's all natural and there's only, vitamins and um natural components, but you just sometimes if you just check the bottle, you're like, and what are all these other things? So that's the thing, we have to be cautious with the supplements, but in general, supplements should be okay to take because they're natural. With things like magnesium specifically, these are this is an electrolyte that your doctors will be checking when there's kidney problems in particular, and they'll know if it's low, high. So in general, unless there's a deficiency, you don't need to be taking that extra. So you just want to make sure that you're not overdoing it or underdoing it, but it's not that it's contraindicated because you have lupus nephritis. It will be more dependent on where are your kidneys at, how are they managing the levels of those electrolytes. But supplements, just be cautious to make sure you know everything that is inside that, because often it's supposed to be a natural supplement, and then my patients show me a bottle and I'm like, "Oh, but this has steroids." Oh, so you just yeah, you think it's something natural, and then you look in the back and it could have all sorts of other things in there, that are not vitamins or natural things. So you just
Um,
want to make sure you look carefully at that list of ingredients.
Oh my goodness, yeah. Uh, Dr. Wells, who was on with us a few weeks ago, he talked about doing a check with a supplement. Like he said, put it in a glass with vinegar, and if it doesn't dissolve, all those extra fillers and things added to it are just getting backed up in you, and they're not really the good stuff for what you need or what you're looking for with a supplement. Okay,
Yeah.
so here is one. Ashley is joining us, and she says, I have POTS where I need a high salt intake. I know a few people in our group have that issue as well, and lupus. So is that like a double negative when I'm trying to think of kidney health here?
Well, no, because you actually need to do that because your blood pressure is too low. So we don't want too low of a blood pressure either. We need normal blood pressure. So
Mhm.
yeah, but I know sometimes it's easier said than done. So it is still important for you to keep your blood pressure at a normal level. We don't want it to go high, but we don't want it to go too low. So the best thing, especially if this is like a new diagnosis and you're just starting on the salt tablets, is to keep a log of how the blood pressures are ranging so that they can work on like how much salt intake do you really need in those tablets, is the blood pressure okay, because the goal is to get you to a normal blood pressure but not high, but we also don't want you to run too low. So it's just
Mhm.
it just takes a lot of diary taking there so that you can reach a good level, but it is important to maintain that blood pressure for the same reason. Too high is bad, too low is equally bad.
Mhm. Mhm. Yes, and we have a lot of people saying wonderful presentation. We've got Emmett joining from San Diego. He was on with us last year. We've got Olive from Ireland here joining in. Uh, Donna has been commenting throughout, and so has Kimberly. Amber is here. Ashley is here. Lupus Spoons from Chicago is here. Kind of confirming what you said about opening up with the doctors and being honest. So lots of people joining today, and it's been wonderful having you and just diving into this topic once again, and a lot of really helpful tips for patients to take on to be proactive in their own kidney health. And as we close up, I always like to know, Dr. Geraldino, like why doctors choose rheumatology. So, what is it about this field of medicine that you enjoy and find fascinating as we close up today?
Very easy question. This is the most interesting field, period. Well, I mean, but in all honesty, it's like autoimmune diseases are really puzzling and interesting to doctors because it's our immune system that's supposed to be fighting other things. Why is it attacking us? So it's just the fact of that phenomena happening. It just makes us be hooked and interested in trying to figure out why that's happening and trying to change it. And I think in particular lupus, I mean, what better people to focus on than young people that
Mhm.
are having all of these issues. We want to really control this because you have your whole life in front of you. So I don't I think it's very easy. It's the most interesting, challenging of all fields, and I think there's so much more for us to learn about it, and it's great how we've made some big progress with some of the treatments and just even diagnostic tools. So and we still have a lot of work to do, so that's the other part. We know this is
Mhm.
an area where we can make a big difference. So
Mhm.
yeah.
Yes, us lupus patients keep things interesting, don't we? A bunch of snowflakes. No two are alike. You never know what's going to happen.
Very
It's
true.
always interesting, never boring, right? With lupus patients. Oh my goodness. Well, thank you again. And thank you to Aurinia for sponsoring today's event. And as always, please visit morethanlupus.com for resources and support. And remember, everyone, that peeing in a cup, it may be uncomfortable, but lupus nephritis stinks a lot more. So get those labs done. Pee in that cup every 3 months. Do not put it off. And we'll see you next time here on More Than Lupus. Thank you all. And this will be available on YouTube once it is approved for you to share with all your friends and family that maybe don't have Facebook. Once again, thank you to Dr. Geraldino. Thank you to Danny and Aurinia, and we will see you next time. Bye-bye for now.